So now let us look at session 3, which is we are going to look at the parasitic conditions of the skin. And so for session 3 of the course, it covers parasitic conditions of the skin such as pediculosis, infection by lice, and then scabies. And in addition, collaborative care for these conditions are also discussed, and then laboratory investigations as well as diagnostic investigations, and then pharmacological management for these conditions are also discussed. And the nursing care as well as client and family teaching regarding parasitic infection are also considered. So at the end of the session, it is expected that the student should be able to describe parasitic conditions of the skin that affect the individual, and then render appropriate nursing intervention to clients and families with parasitic skin conditions, and then interpret results of lab and then diagnostic investigations associated with the parasitic skin disorders. So the key topics to be covered in the session are as follows. We have topic 1, pediculosis, we have scabies, and then 3, we have collaborative management of the skin conditions. So pediculosis, infestation by lice, and the skin may be invaded by these parasites, and they affect people of all classes, but are associated with overcrowded and then unsanitary living conditions. And then they depend on the host for their nourishment, feeding on human blood approximately about 5 times a day, and then they inject their digestive juices and excrement into the skin, which causes severe itching. And so we have 3 types of lice that live on human host. We have pediculosis humanis corporis, which is the body lice. We have the pediculosis pediculus pubis, which is the pubic lice, and then we have the pediculus humanus capitis, which is the head lice. And so let's look at pediculosis corporis. And pediculosis corporis is an infection with the body lice, and the lice live on the skin. Times they are in the clothes and are transmitted mainly by contact with infected clothing and then bed linens. And so the skin lesions occur at the site where they bite, and we can see macules which may appear, followed by wheals and then purples, and at times they are itchy. And so pruritus is common, and then scratching often results in linear excoriations, which can also go on, and then we can have secondary infection caused by hyperpigmentation and then scarring. And so the lesions are most often seen on the shoulders, the trunk, and then the buttocks. We have the pediculosis pubis, and this is infestation with pubic lice, often called crabs. And so this kind of problem spread through sexual activity with someone already infested or by contact with infested clothing or linen. And so they are found in the pubic region and occasionally spread to the axilla and then or men's beard. And so they cause a lot of skin irritation and the intense itching. And then, as we have already noted, some of these conditions are associated with poor personal hygiene. So poor personal practices, either the body or pubic area may be affected with this kind of condition. Again, we have the pediculosis capitis, and this is infestation of the head lice, and the lice are most often found behind the ears and may spread to other areas. At times, they even make the hair very difficult to manage, because they bring the hair parts together, and it becomes very hard even to separate. So the lice are transmitted by contact with an infected person, and the manifestations of the hair lice may be pruritus, scratching, and then erythema, which may be as a result of the inflammation of the scalp. And then if untreated, the hair appears matted and then crusted, and then with foul-smelling substances, and that is associated with poor personal hygiene. Quickly, let's look at scabies. Scabies has different names in our local places. Some people call it jiba, you know. Others, I don't know how it's called in other languages, but in the Akan, They call it juba juba. Others call it code de say, different names. And we know what I'm talking about. So scabies is also a parasitic infection caused by a mite, and the pregnant female mite burrows into the skin and lay 2 or 3 eggs each day for about a month. So you can imagine what could happen. So the eggs hatch in 3 to 5 days, and the larvae mature in about 10 to 14 days, and they migrate to the skin surface that burrows into the skin for food or protection, and then the larvae develops, and then the cycle continues. So on the skin surface, you know what happens. So the incubation period varies, but often long period elapses before symptoms are noted. So the incubation period in persons with no previous exposure is up to about, say, 4 to 6 weeks. And so scabies affect all kinds of people, all people in the socioeconomic class. For instance, we have residential communities, shelters, schools, dormitories, college dormitories, and other crowded living environments. These places are all conducive to mite transmission. So close skin-to-skin contact is a typical transmission route, but the mite can live for 2 days on clothing or bedding, and then can still affect individuals. And so the infestation is found in webs between the fingers, the inner surface of the wrist, and then elbow, the axilla, on the penis, the waist, breast, thigh, lower buttocks, and then the genital area. Other specific areas can also be identified. So initial skin assessment may reveal the presence of thread-like linear or serpentinous shaped gray-brown burrows, which are less than 1 mm wide, sometimes covered with vesicles. And here we are talking about configuration or the shape of the lesions that they cause. And so the collection of the lesions appear on the rash, and then we have pruritus in response to the mite or its feces is common, and especially at the night, excoriations may develop. And so excoriations predispose the person to secondary bacterial infection, and that is a superimposition by a microorganism. Somebody was telling me a story that almost always the female organisms are very troublesome. If you remember, even the Anopheles mosquito is the female that causes a lot of problems. So here too, the female scabies is causing a lot of troubles. It's very interesting. So once we have looked at this, especially for scabies, we remember that at night it can cause a lot of, at night it comes up, and that is where it comes up to feed on the skin surface, and they cause a lot of havoc and itching. And so when people are affected at night, you can see that they do a lot of scratching. People cannot sleep. Let us look at the collaborative management of parasitic skin conditions. In some cases, it may also be very important to do some kind of a laboratory and a diagnostic test. So parasitic infections are diagnosed by identifying the organism and are treated with medications that kill the lice or the mite. So diagnosed by skin scraping and the microscopic examinations of the mite or their feces. So pharmacology, lice are eradicated with agents that kill the parasite. So infestations of the body, the pubic area are treated with topical medications that contain gamma benzene, hexachloride, and then malathion. And these are, and then we can also use pyrethrum to also treat. And the infestation of the head lice are treated with shampoo containing lindane, and then we have several of them. But we have, for instance, the head lice in some local areas. We have this camphor. These are used local preparations to treat, but we can also use shampoo containing lindane, and then the shampoo is applied to dry the hair, and then massage with small amount of water to produce a lather, and then hair is scrubbed for about 4 minutes. Then we can rinse with plain water, and then the treatment may be needed to be maybe repeated in a week to kill new hatched lice, and then a fine tooth comb can be used to comb and then bring out the nits off, and then hair shaft. And then scabies may be eradicated by single treatment of gamma benzene hexachloride lindane lotion applied to the entire body surface. We can also use elamine 5%, which are used as follows. We can use the permethrin, which is elamine for a 5% applied at bedtime to the toes, and then the showered off in about 8 hours time. As I've already told you, it's in the evening, the night, when the organism comes out. We can also use gamma benzene lindane, and that is applied at bedtime in a thin layer over the entire body from neck down, and then wash off 8 to about 12 hours time. And so the associated itching is also treated with systemic or topical medication, including corticosteroids, and the secondary bacterial infection may also be treated with appropriate topical or systemic antibiotic. And in some cases, we have benzyl benzoate lotion. Most hospitals in Ghana use this. And so for scabies, benzyl benzoate lotion, we can use it for scabies, pediculosis, capitis, and then pubis. And then first you scrub entire body with soap and water before it is applied, and it's applied to the scalp, and then leave it overnight, and then you shampoo out in morning, and then repeat next night if necessary. In some cases, what happens is that before we can use benzyl benzoate, we have to wash the patient's clothing with warm water, and then make sure that before we apply. Other than that, we can apply it, and then later, because the clothing are all infected, the condition can still come back. So it's very important that the households, those who sleep in the same room, all their linens are washed with warm water, with soap, and then before the medication is applied, especially at night. And so the nursing care, it's very important that we consider patient education and then family education, because most of these conditions are associated with poor hygienic practices. And so we also need to take care of anxiety related to the presence of lice and social embarrassment. Because of this, of late, we know that some of these conditions are still occurring despite the education that we offer to our patients. So if somebody has anxiety related to embarrassment and then social issues, we need to consider all these things as part of our education. A risk of infection to the related to pruritus from mice, we need to look at that. And then the knowledge deficit of transmission is also very important. We need to include all these things. And the impaired skin integrity related to excoriation from pruritus, we have to consider this. So client and family teaching is necessary to facilitate treatment at home and to prevent the spread of the condition. So as part of our teaching, we have to look at all this. We have to look at the need to wash clothing and linens with soap and hot water, or have them dry, cleaned, and then iron the clothes. It's also very important to kill any lice, eggs, and the personal care items such as combs, brushes may be boiled to kill the parasite, and all family members and sexual partners must also be treated. Avoid using combs, brushes, and then hairs of other people who are also affected. So we come to the end of the third session, and here we have our references that are there. If you have this book, Max Medical Manual 2002, probably you can also get the current version. We can have some of these conditions and how they are managed medically over there. Thank you very much.